These are basic things that are going to change your dental health, and it's going to change your overall health. Hey guys, it's Sandy. So I want to get on here and talk about something super important, because I want to talk about getting healthier in 2025, just because we're such a sick nation, and focusing on our health is going to be really important. But what we don't think about when we're talking about getting healthy is our dental health and our oral health, and how incredibly important it is to our overall health. When we talk about health, we think about what we're supposed to eat or exercise, but we don't talk about how our dental health is connected to disease. So I was listening to a doctor on a podcast, and he said flossing can help reduce your risk of getting Alzheimer's or having heart disease. And I was like, what? And it intrigued me. And so I listened to a few other doctors and dentists, and just listening to what they have to say. There's a lot of different ones on YouTube and different ones on podcasts. And I did a little bit of research because this was important to me. I have always taken care of my teeth, but I got to change some things, and I got to do some things a little bit better. And I wanted to share this because I think most people probably need to. Do you know that plaque and then gum disease causes chronic inflammation in the body? So that bacteria that is in there can go straight into the bloodstream. That inflammation can go up to the brain. It can go into the heart, and or throughout our whole body, and cause major disease. But there are things we can do to fix that. Some easy things you can do at home. So everybody knows to brush your teeth and floss, right? But how many of us actually do? So brushing the teeth, I brush my teeth twice a day. I brush them in the morning, brush them before bed. But flossing, I'm not so good at. And flossing is very important to do also, to help remove the plaque. Now, logically, this one doctor said, I floss my teeth, then I brush my teeth. And I was like, oh, that makes sense. Because what he said is, rather than brushing your teeth and then flossing, I want to floss, get anything out. Then when I brush my teeth, the toothpaste can do a better job of getting, in there and do the job that it needs to do. So that's something I don't do. I'm going to start doing. I'm going to floss my teeth, then brush, but I'm actually going to start flossing more regularly. I have not. Some people only get their teeth flossed whenever they go to the dentist every 6 months. Some people do it maybe a little bit more often. But this study, what the doctor was talking about, is said the frequency of flossing makes a huge difference. Even if you floss every other day, the bacteria level, there was a certain bacteria, he was saying, goes down so significantly in your mouth. And that is the doctor that said, do you know that flossing can reduce your risk of Alzheimer's and heart disease? And so I was like, oh, and he said, of course, if you floss every day, you even have a better, this bacteria is gone from your mouth. So he said, so I will tell everybody to at least floss every other day. So I am going to start doing that. Well, no, I'm probably going to just do it every day because it's easy to do. So I carry dental floss with me whenever I am out and about. As far as, I always have some in my car. I have one tooth that seems to get anything. If I'm eating celery, eating meat, whatever, it gets stuck in that tooth, so I need to get it out. But I don't regularly use it. And it is so good for your gums and your teeth to regularly floss. Now, some major points that he made was one about mouthwash, and that mouthwash isn't so good. So what is happening is, like Listerine, let's say. Listerine, it disinfects in your mouth, but we don't need that because our oral microbiome is very important. There are good bacteria and bad bacteria in here, just like in our gut. We have good bacteria and bad bacteria. We need to keep that good bacteria. And what happens is, with some of these different mouthwashes, they are so strong, they disinfect everything and just take everything away. So you don't have those good bacteria still that you need in your mouth. So, and there was even a lawsuit September of 2024 against Listerine. I think it was their Fresh Mint Listerine, of causing cancer. So it was for people that used it daily. But still, if you don't use it daily and use it only every once in a while, you really want to put yourself at risk with the possibility of cancer or different things. You can look up that lawsuit. It was filed September of 2024. So instead of trying to wipe out your entire microbiome, instead, brushing your teeth is very important. Brushing and flossing. That helps take away some of that bad breath anyway. If you are regularly I know whenever you are brushing your teeth, brushing your tongue and then the roof of your mouth takes away a lot of the germs that cause bad breath too. So make sure and cleaning your entire mouth and not just your teeth. But listening to him talk about mouthwash, and also that they've done studies where mouthwash shows that it increases blood pressure. People that use mouthwash regularly had higher blood pressure. Whenever they went off of it, within 5 days, the blood pressure went off or went down when they stopped using it. So some very basic things to do is hydrate in the morning. So he said he drinks a glass of water every single morning first thing. Well, I do that for a different reason. He said he does it to get the saliva in his mouth going and get, just everything moving that needs to. I do that to get everything in my body moving, get those organs woke up and just flush out. You've been asleep all night long and you need to flush out your system. So no matter what, it's good to hydrate in the morning. So drinking a glass of water first thing in the morning is a very important thing to do for your whole body, but also for your dental and oral health. So let's say you just had a meal. Well, I brush my teeth morning and night. I do not brush my teeth every time I eat. So what to do after you've eaten is just rinse out your mouth with water. So that will kind of loosen up anything that you had caught in your teeth, but it also will just rinse off your teeth. So just rinsing your mouth with water. You could also rinse your mouth with some salt water if you wanted to, but rinsing that out just helps to clean your teeth. Now, I do that because I started drinking tea. I didn't used to, but I love herbal tea now, and I really enjoy drinking it. But you know what it does? It stains your teeth. So I make sure that whenever I do drink a cup of tea or a cup of coffee, whatever you're drinking, just rinse out your mouth with some water, and that'll just kind of help take the staining off of your teeth. So another thing that I like to have with me, I keep this in my car. I also have a few in my purse. My friend had these in the airport whenever we were there. One time we were waiting and she's like, oh, here, you want one of these? Just to freshen up your breath. What it also does is it has like a pick in there. So basically like a toothpick that can get right into your teeth and help clean them out. Has a little toothbrush on it, and it kind of has this freshening something on there too, like not really toothpaste. It doesn't make bubbles, but it just freshens your breath and also freshens your teeth. So these are nice to have if you are out and about somewhere and you just need some way just to kind of clean your teeth or clean out your teeth. I really like these. I got these on Amazon. So a big thing that I do, and I've done for a while, I kind of do it in spurts. Like I'll do it and then I won't. But it's using coconut oil for oil pulling. So this I use in addition to brushing and flossing. So you have to brush your teeth. You have to floss your teeth. This is in addition as something else that's really good. So right here, coconut oil, you can do oil pulling, it's called. What it is just swishing oil around your mouth. It is said to reduce gingivitis, reduce plaque, whiten teeth, takes the harmful bacteria away. Well, there is a lot to that because it contains lauric acid. Lauric acid is an antimicrobial, antibacterial, so it helps to pull the bad bacteria out of your mouth. So if you swish this around in your mouth and then you spit it out into a trash can, then you're helping remove that bacteria. The thing about this, though, is it's not removing all the bacteria. So I said with Listerine, I'm just going to say mouthwash in general. With mouthwash, it disinfects and it takes everything out. This does not. This takes the bad out, but still keeps that good bacteria in there that we still need also into your mouth. So lauric acid in coconut oil is good. Now what you do is I just take a spoon. Coconut oil can be used for so many things. I just take a spoon. I put about this much on here. It's about a tablespoon worth. I found that if you do too little, then you don't have enough to swish around your mouth. If you do too much, you're just like, you can't even move your mouth. So about a tablespoon is what I do. You put it in and you just start swishing, and this solid will turn to liquid in your mouth. Now I can tell you firsthand experience that some dentists will say, no, it doesn't work. Some of them say, yes, it does. The beauty of this is it will not hurt you. So it really doesn't matter what somebody's opinion is. It won't hurt you. I can just tell you from personal use that it does lessen bad breath. So it is taking bacteria out. I can wake up in the morning and I do not have that same bad breath. It's just not there. So I do use this in the morning. I don't do it every single morning, but I do it quite a few times a week. And swish it around in your mouth. If you read online, oil pulling, it'll say to do it for 10 to 20 minutes. That's too long for me. My mouth gets tired. So I do it about 5 minutes, 7 minutes. You just do something else. You put it in your mouth, you start swishing, and you do something else. And then you don't even think about it. and then you spit it out in the trash can. This goes back to solid when it gets cold, so you cannot spit it out in your sink or it'll get into your pipes. But just swish it around, it'll turn into liquid, spit it into the trash can, and you just did oil pulling. So you're pulling out the bad bacteria. I have said before in a video I did on this, is I could feel some plaque on the back of my tooth with my tongue. And after I did this for a while, it was gone. So after a few weeks, I could not feel that plaque anymore. My tooth felt just fine. So whether you're a skeptic or not, I'm just telling you my personal story with it, that they've used this for centuries in different countries, and it has worked for me. So in addition to flossing and brushing, and I'm going to start saying flossing first and brushing, because flossing first, getting that out, then brushing and letting your toothpaste do the work. We have found plaque in the brains of people with Alzheimer's. So we know that this is true, that gum disease really does cause inflammation in the body, plaque build up in between your teeth, inflammation, the bacteria in your mouth from the gum disease can go through your blood system. Like, there's so much with our oral health that would determine how healthy you're going to be. Eating good food is very important. At least 2 fruits a day, 3 vegetables a day. Eating good food is good for your overall health, but it is good for your oral health also. So there's a lot you can do that's super simple. I don't have all the answers. I'm not a dentist or a dental hygienist. If you are, please put your 2 cents in here and comment, because you know so much more than I do. I just want to get this news out because there's so many different things we can do for our health to make us a healthier group of people. And that's what we need to do. We need to learn from each other. So please comment and let me learn from you too. Okay, you guys, that's all I have for now. Until next time, I'm out.